A special thank you to him for his support of higher education in the state of Florida. And in fact, in his first year as governor, he approved the funding for the Morsani College of Medicine, which is where we are today. So, Governor, welcome to the University of South Florida.
Thank you. Well, thank you. It's great to be here. I really appreciate everything that USF means to the state of Florida. We are fortunate to be seeing numbers, key metrics decline in the state of Florida with respect to COVID-19. COVID-positive hospitalizations are down roughly 60% since the July peak. ICU COVID-positive down 52% since the July peak. The total number of people who are COVID-positive in Florida hospitals represents about 6% of all our licensed beds. And the number of hospital admissions we had statewide yesterday, which is usually a weekend, usually a big day for admissions, is the lowest since we've had in the middle of June. We have lower cases today, although, how much, I think there's a lot of problem with these PCR tests, as we're seeing in some of the reports lately. Our antibody testing remains strong, and the capacity here, 27% of hospital beds are empty, 24% of ICU beds are empty. That's actually not, you actually want to have more than that just generally when you're running these things. That is a way higher percentage than if you would have done like March 1st in the state of Florida. There would have been much less capacity even before the pandemic really hit. And I think the most important metric, our ED visits for COVID-like illnesses, are down I think over 70% since the July 7th peak. So those are all good indicators. Obviously, we want to continue that. We're going to continue to focus on the main kind of pillars of what we've done. One, protect the vulnerable. That involves long-term care facilities and a lot of the things we did there, but also coming from the villages. It also involves supporting those types of communities where you have active senior populations. They remained active. But they remained active in a smart and safe way, and I think the results that they've had there, given the demographics, I think are very, very pleasantly surprising. Actually not surprising if you know them, but certainly better than I think what a lot of people thought would ended up happening. So that's a real key, given how COVID-19 operates under different age groups. We also want to continue supporting hospital capacity, healthcare workers. We have done tens of millions from the state, articles of PPE, face masks, face shields, gloves, gowns, you name it. It's been one of the biggest logistics operations in the state's history. We also stood up and supported with personnel. When you had certain hot spots in the state with a lot of hospital admissions, we would send folks down there, nurses, respiratory therapists, whatever was required, and I think that worked very well. We also have our COVID-only nursing facilities. There's 23 of those across the state. That's a safe way to isolate residents of long-term care facilities who have been infected and can't appropriately be isolated at their own facility. And we also made the decision, as we were seeing the prevalence increase dramatically, not just in Florida, but across the Sun Belt at the end of June, to maintain hospitals doing elective procedures. The advice in March was to close those. So across the country, everyone closed elective procedures. Florida, we reopened at the beginning of May on that, and I think that doing it the way we did it this time was much better. So you had some hospitals had to draw back a little. Others didn't. If you look at like some of the big systems in Orlando, they didn't have to do it. Miami-Dade, some of those, they had to curtail it. But they were in the best situation to understand that. And healthcare is not limited to one respiratory virus. It includes all these other things that are very important. So that was really important. And we think we help support their operations by allowing the elective procedures to continue against the advice of people who are some of the folks who are considered experts. And finally, we wanted to keep society functioning. We've been able to do that. We've gained jobs in July. You have all kind of things from our theme parks to beaches, restaurants, all that, hotels. Those have continued operating. Obviously, we need to put way more people back to work than what we've done, and we're going to continue to work on that. But part of, I think, keeping society functioning is having K through 12 schools as an option for in-person, which many parents have been really glad to have that option, but also our university systems. And USF I don't think there was really any question you guys were going to make it work. I think you've done, you've worked really hard at it. We were just talking with the folks at UF Health with what they're doing at the University of Florida, which I think has been very thoughtful. So having our universities up and operating is very, very important. We want to continue to support those efforts going forward. And of course, that involves the instruction, which is, of course, key. Also involves things like athletics, which we're glad you guys are going to be playing football, and we're glad that our other teams are going to be playing as well. So I appreciate the White House supporting a lot of our requests, whether it's medication, whether it was early PPE or testing. And, you know, Dr. Atlas has been with us all day, and I think has been somebody who's been very, very strong on understanding that when you deal with a pandemic, you can't just turn a blind eye to everything else in society except one particular virus, that you obviously fight the virus, but the best way to do that is to have a strong society. And so he's identified the need to make sure other medical procedures are being done, to make sure schools function, and make sure people have more opportunity. So I want to thank him for being here, and I want to offer him the opportunity to come up and say a few things and answer a few questions.
Okay, thank you, Governor DeSantis. It's a great honor to be here, and I've been speaking with Governor DeSantis for quite a while about the pandemic, and he's really an example of doing something with the exact thoughtful approach that we need in this, because this is a policy issue. It's multifaceted. It's not just stopping COVID-19 at all costs, and President Trump's strategy is really is similar, very similar to this, which is 3 points, really. You got to do your best to protect the vulnerable and the high-risk people. You have to make sure that the hospitals are still functioning and not overcrowded, because this so-called non-essential care is actually critical care, and I can go into that, but the lockdown is very harmful for other medical care. And of course, point number 3 is safely open schools and open society, because it's really harmful to our children to have closed schools. Online learning is not the same. They miss all the educational aspects of socializing, sports, nutrition. Reported child abuse is not happening. All kinds of things that people really didn't consider. And of course, that applies to the university system as well. And we have to get America back to work. And I think these are all doable. We know how to protect people. We've done a great job now in working on people who've been hospitalized. The lengths of stays are 1/3 what they were in April. Mortality's down 1/2 if you get hospitalized. Case fatality rate is 80% down in the United States. And a lot of things have been done by the Trump administration, including, of course, in partnership with Florida. I think it's a great example of how the federal government works very well with the state. The states are in charge of their policies. You know, we help, we issue guidelines, and also massive resource allocation, particularly to Florida here, with things like PPE, testing. We are now going to have in the next couple of weeks every single certified nursing home in the U.S., 14,500, will have point-of-care testing. We're also making a big effort to get, we have this massive testing apparatus that the President, the Vice President, and Admiral Giroir and the task force have been directing. And we have this capability now of really getting point-of-care testing to people who are elderly and high risk, but not necessarily in nursing homes. So we'll have senior centers, other assisted living facilities have this sort of access. And of course, we know the cases come in from the community into the nursing homes. So we really got to, you know, we're doing much better with that. It's very challenging. The whole world has had a problem protecting the high risk. I think we're doing a great job, and Governor DeSantis has been doing a really terrific job, given particularly that Florida has second highest population in the U.S. of people over 65. So, you know, all of this allocation of resources is now going to be used in a very smart way. And, you know, we have a lot of reasons to be optimistic in the United States over how things are evolving. And again, like President Trump, Governor DeSantis is using the data and the science, and really fear is not part of the equation here. We actually have a good handle on what's going on. There's a lot of reasons for cautious optimism in the United States, and happy to talk or take any questions. Yes.
So the CDC just said that 94% of COVID deaths in the U.S.
Well, I think this is a very important point. It's true. Almost everyone really has significant comorbidities. Certain comorbidities are more important than others. I mean, when you have to look at the data and the science in sort of a detailed way. For instance, hypertension alone, depends what you read, but hypertension alone in a paper by Williamson in the journal Nature is not alone a significant risk factor. And there are many people with hypertension, but that's very different from certain levels of obesity or diabetes. So we actually harbor the highest percentage of people in the world with these comorbidities. That's very true, and that's why we're very cautious about making sure we protect people with high risk. Diabetes is one of those significant risk factors. Now, having said that, given that we have all this population, I think this is something that's not really in the news, is that when you calculate how the U.S. has done versus Europe, we see that the deaths beyond baseline, meaning deaths compared to a non-pandemic year, the U.S. is 33% better than Europe in its performance. Okay, this is not in the news because we have a tendency to be very superficial about how we're thinking. So yes, I'm concerned. We're all very concerned. The president, everything that's about this strategy is directed at protecting high-risk, vulnerable people, and we have to be very cautious with that. But we have to also educate people on what those morbidities are, those comorbidities. So your question is a very good one.
Excuse me, sir. For the Floridians that don't know who you are and didn't know you were advising our state for the past few months on coronavirus, can you give us a sense of what you've been working on with the governor and what policies that you've
Sure.
helped implement?
Sure. I'm one of many people, I assume, that the governor has spoken to. I wasn't formally advising the governor, but I've had conversations because people like me, there are many of us in the world who I personally have a 25-year history at the highest levels of academic medicine, integrating information really in my field from other high-level subspecialties like infectious disease, pediatrics, et cetera. And then I have 15 years overlapping, because I'm not that old, of health policy work. And so when you have somebody who understands medical science and health policy, and you have a governor who is smart enough to understand that this is not just stopping COVID-19 at all costs, it's actually a policy issue. He's, I'm sure, consulted with many, many people. I'm just one of them. I did not have a formal role. I didn't mean to say that in speaking with the governor of Florida.
Governor James, can you give us a sense of the types of issues that you sought his guidance on and sort of how he affected your policy?
I talk to as many people as I can. Obviously, Scott is a part of the task force. I've spoken with, everyone on the task force multiple times across a variety of issues. And it's interesting, Dr. Atlas is here. I think almost everyone from the coronavirus task force has been to Florida. Obviously, the president, vice president, Dr. Birx, Admiral Giroir, Steve Hahn, HHS Secretary. In fact, they were all here in Tampa when we did that. And so I think it's been good. And I think also just Scott coming from Stanford, I think Stanford's had a lot of great folks who've really been very evidence-based. I think if you look at some folks at Harvard Medical School, I know we've spoken with some of those folks. And then, Oxford has done a phenomenal job. If you look over in the United Kingdom, they have a Center for Evidence-Based Medicine, and I think that they've been really good on a lot of different things. And so you just have to read a lot, but I think that if you actually look and study and read stuff and are familiar with what's the latest thing coming out of Oxford or what's the latest thing coming out of some of these places, you can kind of really helps inform you. And you also see some of the stuff that's come out has been junk and has had to be retracted, or the media puts a spin on it and it turns out upon further review, wasn't something that was really good. Yes, ma'am.
Governor, will you release information about the number of students and staff with COVID at specific schools and how fast can we get this data? Schools are open at.
So the Surgeon General addressed that this morning, so that was his thing. What I've said is, put out as much information as we have, but let's also put out, if somebody tests positive at a school, were they symptomatic or not? Were they actually sick? I mean, isn't that what we're really concerned about, whether people are getting sick or not? And I think what we're finding is the CDC has said that you can test positive for up to 12 weeks because this PCR test is very sensitive. It can pick up just dead virus inside you. And then there was a study that was done, I guess, Massachusetts, New York, and Nevada was in one of the papers this weekend, saying that they looked at all the positive cases over a certain time period, and they found that 90% had insufficient viral load to be contagious. Well, aren't those the things, like, if you're positive, are you sick? If you're sick, then we need to help you. If you're not sick, can you spread it to someone else? I mean, those are really the most important things. I've asked folks, just, because we have all these labs, how are these labs doing it? What's going on with all that? But I think it's very important to say who has tested positive and who is actually symptomatic. Because if you're not symptomatic, these PCR tests, we cannot say that you actually were infected at that time, and we cannot say that you were actually infectious at that time. And I think, Dr. Atlas, I think we're in agreement on focusing strategies in school on people who are symptomatic. If you're sick, stay home. If you come and you're sick, obviously get sent home. But that goes for faculty, too. The cases we've seen, well, first of all, it's also important whether someone's infected in school or not. Because you have people that are coming to school, they didn't get infected in school in a lot of these cases. How many in-school transmissions can you document? And then how much of it is a teacher coming in who are symptomatic? And I think our guidance is, if you're symptomatic, then obviously stay home. But really focusing on that, I think, is really important. I am not a fan, and I'll let Dr. Atlas weigh in, of doing like what they did at that school in Georgia where, okay, someone was sick, so anyone who was in the hallway with them has to isolate for 2 weeks. Well, you're isolating healthy people, and the school children are typically not the index cases with respect to transmission. So it's got to be done, I think, surgically, but broad-based quarantines of healthy people who we have no basis to think are contagious, I think is not the way to go. You have to ask him. He addressed it today. Whatever he did that people made a big deal was not something that I was involved with.
Yeah, I mean, I would just echo that, and you can look at the new CDC guideline this week on testing, because there's no desire to decrease testing. In fact, we're going to increase testing, and that's been sort of misreported. But I think that the genesis of this document is really to do very smart testing, because the goal of all this testing is to save lives. The goal is not to document asymptomatic healthy people, if you think about the entire policy here. And so we're doing very, very smart use of what is this incredible armamentarium of testing that the United States has developed. So I think that we're all on the same page here. It's a very, very smart, strategic way to really drive down the deaths and the damage from the virus and still allow schools and businesses to safely reopen. That's the point.
Dr. Atlas, can you address a little bit about the vaccine development progress? I know President Trump last week had mentioned that he's looking for the vaccine to go out by the end of the year. So is this something that Florida is getting their hands on, like a year before, or when?
Sure, I can answer just broadly what's happening in that, there has been an amazingly quick development of vaccines. I mean, no one had anticipated this Operation Warp Speed effort by the Trump administration. It is anticipated that there will be close to 100 million doses of a vaccine by the end of the year. Of course, the way vaccines work, there's a prioritization of people who are high risk to get vaccines in general. That's the way a pandemic vaccine works. But so I anticipate that. It's still they are enrolling subjects into the vaccine testing, and the enrollment is going very well from what I understand. I'm not directly involved in the vaccine development, but people are very, very optimistic that we're going to have a vaccine in what is really sort of unprecedented time, honestly. So it's all moving very positively. Yeah, but I don't know the details of this. I don't want to speculate on how that distribution will work, but it will be done by the people who know what they're doing with that. But that is the intent. Obviously, the doses are going to be available to be implemented. That's the whole point, yes.
We have a replacement, and we'll give you that name very soon. So I think we've got, John Satter came in to look over just the unemployment because we obviously were having major issues. It wasn't being moved along the way we wanted it. John came in and really, I think, helped get it up and running. But John also has an agency that he's got to look over, and so we'll be hopefully having the announcement, I think probably tomorrow, and we'll have a new secretary there, and I think it'll be good. And I think that there's some things that need to change in that agency, and we want to make sure that we can.
Would you say that Chief Lawson was at fault for all of the delays that we've been seeing throughout the past 6 months?
Well, you're not seeing delays now. I mean, we're cranking out. I mean, the amount of money that's been cranked out. I mean, I think it's $13+ billion. Massive numbers of folks who are doing it. Obviously, you go back to late March and April. There needed to be changes made, and so we were able to do it. It took a lot of effort, and it was a difficult experience. And I know there was a lot of people that went from having a job and being happy in mid-March to being all of a sudden not have a job and then not even be able to get someone on the phone or whatever. So it was really a stressful time for a lot of people, and it was a difficult system. But at the end of the day, I think John helped us get it moving, get people paid, and we think that we're going to be able to also offer some enhanced benefits here coming up pretty soon. We're just waiting for the Secretary of Labor. So he's got to run, so we're going to